as were killed in the war in Afghanistan, with rates of post-traumatic stress and homelessness at record highs among vets. Almost 1.5 million veterans are uninsured. And joining us now, the host of the Ed Show, Ed Schultz, and Brian McGough of VoteVets.org. He fought in wars in Iraq and Afghanistan. Thank you both for joining us. So, Brian, I'm sure Ed will understand. We're going to start off with you. Ed's in studio. What is your reaction to this? I mean, we talk so much about loving our troops and taking care of them, particularly at the beginning of the war in Iraq. You heard people, waving their flags and their pins on their lapels. But these numbers are startling.
They are startling. And when veterans come back from the wars, they have 5 years where they get VA care, and then you may or you may not qualify for VA care. And if you don't qualify for VA care, I mean, we're seeing reports right now where Iraq vets are having a hard time getting jobs. If they can't have jobs, they can't have health insurance, and that's why we need, some health reform in this country, a robust health reform to kind of get things straightened out so vets can have health care.
Well, Ed, the president, when he was talking about overall health care reform, said it's a moral responsibility. Does it take on an extra level when you think about these vets who come back with, for example, post-traumatic stress, and they can't even get the treatment they need?
Well, a lot of times a post-traumatic stress disorder leads to joblessness, and then it leads to homelessness. The number of homeless vets in this country continues to rise, and it's just not Congress throwing money at it. There's a lot of infrastructural things that have to go with it. You have to have visits, obviously. You have to have them covered, but you also have to have follow-up to stay with that veteran, to make sure that veteran gets proper counseling and job training. It's the full package, and the startling thing about this is that we're on the verge of making another big commitment to Afghanistan, and over the last 8 years, these numbers have not gone down, they have increased. So when we talk about veterans reform, veterans help, and it is true that we got to get health care reform that could include a lot of these vets, but the fact is a lot of these homeless vets are chemically dependent, and to get chemically dependent people in the right direction, it takes a lot of sweat equity, a lot of commitment from people who really want to see this turned around, not just money.
Brian, I want to ask you, what goes through your mind when you listen to the debate and you're cognizant, you're aware of the fact that 2,200 vets estimated die each year because they lack health insurance, part of the 46,000 Americans who die each year. What goes through your mind when you hear a couple senators say, oh, you know what, maybe I can't support overall reform because I've got a problem with this abortion provision, or I've got a problem with this public option? What goes through your mind?
Well, it's important to remember that almost all bills up there are compromises, and people like to play their little games with these bills. And you're looking at some of the things we're looking at right now is some money issues. People are concerned about how much things cost. In fact, Senator Coburn himself is single-handedly holding up a veterans bill because he doesn't like where the funding is coming from. So VoteVets.org, we dropped off a petition with 13,000 signatures to his office today saying, hey, you have to pass this bill. You're talking about veterans health care. You're not talking about things that can be put off. These men and women are downrange fighting and dying and getting hurt, and you're sitting here trying to block this bill. And this all comes into the VA. I mean, these people need to be taken care of so that they can get well and they can keep their health insurance if they ever switch over to public health insurance or private as well.
I want to bring Ed back in on this point with Senator Coburn. What do you make, Ed, of someone saying that this would cost too much, but we don't or did not hear a lot of talk about the cost of the wars in Iraq and Afghanistan?
Well, we're having no discussion. In fact, I talked to Jack Jacobs, the colonel, about this today. We're having all this discussion. We're vetting every dime that's going to health care reform. We're not saying a word about how much money it's going to cost to go to Afghanistan if there are another 40,000 troops going. I mean, that is a long-term financial commitment. So the discussion of the country right now, if the House health care bill were to pass right now as is, a lot of veterans would be helped because a lot of them are under $40,000 a year and a good portion of their income would be subsidized. So this health care bill as it stands right now from the House would definitely help the veterans, and it would take a lot of these other problems off the table. Coburn's position is, they're all about the money, they're all about the budget, they're all trying to be fiscally responsible and go home and say, hey, I didn't raise your taxes.
But the Republicans in the past obviously say that they are also about the military, that they are the voices.
They played that game really well. They played that game as well, those soccer mom vans with the, we support the troops.
Yeah.
Well, this is how you can support the troops. You can make sure that this legislation goes through for health care reform, and you can make sure that the veterans really we keep pace proportionately with the number of veterans that are coming back and coming into the system that are coming home, that we keep proportion as to the kind of help that they're going to need.
David?
Ed, what's the political impact? And I hate to be sort of using crass terms like politics, but that's how things get done in Washington. What's the political impact when senators here, 2,200 veterans die each year because they don't have health insurance?
It's a great television commercial. It's great campaign fodder, but I'm not convinced that it moves a lot of people to the polls to turn one voter or another on how they're going to vote. It's easy for a politician to go out and say, I support the vets and I'm introducing legislation that's going to help the vets, and then it pretty much stays right there. To the credit of the Congress in recent years that they have done some things with the veterans. You've got the GI Bill that passed. Jim Webb of Virginia, new senator in there. He got something done. He dedicated a lot of his time to it over the last several years. So that is something positive that's helping. But the key question here is, what are we going to do to keep pace with the number of veterans that are coming back? And politicians speak well to it. Very seldom do they really act.
All right, Ed and Brian, thank you both very much for joining us. It's an important conversation, and certainly be sure to catch